to welcome everybody here today and say thank you for coming. I am Wyn Kirby, and I'm going to talk with you today about what you can do with your hands in a sudden cardiac arrest. And I am going to be speaking from 20 years of nursing experience and extensive research on this subject. Are you familiar with what sudden cardiac death is? Sudden cardiac death is defined by the American Medical Association as an unexpected death caused by a loss of heart function. Sudden cardiac death causes 350,000 deaths a year, and half of those are people that already have known cardiac disease per the American Medical Association. All right, do you know what someone at risk for cardiac death looks like? The Mayo Clinic has defined some of the factors as being someone that has a history of high cholesterol, someone that is overweight. Males tend to have more episodes of cardiac death. Someone that smokes or someone that drinks excessive alcohol are all at risk for having sudden cardiac death. Some of the symptoms that you may be having an imminent cardiac arrest can be extreme anxiety, dizziness, or the fact that you have a rapid heartbeat. You want to say my heart's just beating out of my chest. Those are all signs of a possible impending cardiac arrest. Unfortunately, only half of the people get signs. The other half, there is no signs at all. All right. So when the heart stops beating, you only have a few minutes before the person dies, unless circulation is returned or restored. And the Journal of American Association has said that CPR is the way to continue the circulation until medical intervention can happen. There are actually two types of CPR. I'm going to focus on hands-only CPR, but there are two types. One of the physicians, Dr. Orkin, who's a physician with St. Michael's Hospital, which is part of he is part of the research team that focuses on resuscitation outside the hospital. And he has highlighted one of the drawbacks to hands-only CPR is the fact that if you are trying to implement that in a rural area, that it can be detrimental to the patient simply because in a rural area, sometimes it's 20 plus minutes before an actual medical response can occur. So that is one of the drawbacks, although we're going to focus on it today because you really can make a difference with hands-on CPR. Today I'm going to review for you the handout that I gave you when you came in. I'm going to demonstrate hands-on CPR, and then I'm going to tell you some avenues to get certification if you want to go further and have either of the types of CPR certification. All right, for the handout that I gave you, it starts with check and call. You want to check, make sure someone is non-responsive, see if they have a heartbeat and if they're breathing. If they're not at that point, you need to stop and call 911, okay? Then come back. If they continue to be unresponsive, begin your hands-only CPR. You begin that by giving chest compressions, and to do that, you're going to lock your hands, put them over the chest, lock your arms, and start compressing at about 2 inches of depth and at about 100 beats per minute. Okay. The only time that you can stop this is there are several times when it becomes obvious that they've regained consciousness or that they're breathing again, when a trained person comes in to take over, the scene becomes unsafe because sometimes that occurs, or medical personnel arrives with an AED, which is a medical device to help stimulate the heart, or, unfortunately, if you become too exhausted to continue. All right, so I'm going to give you a quick demonstration now on hands-only CPR. I'm going to lock my hands. I'm going to go over the center of the chest, lock my arms, and 1, 2, 3, 4, 5, 6. You continue to do this really to the tune of staying alive because you want to do it at 100 beats a minute. Okay, and that's simply hands-on CPR. Hands-only CPR. Now I want to talk with you about ways that you can obtain more information. There are several ways in our community. Monroe Regional Medical Center offers the classes. You can also get them from Ocala City Fire Rescue. They offer the classes. And you can actually go online just to gather the information. You can't get certified without the demonstration, but you can obtain that. All right, remember what you can do with your hands is save someone's life. That's really important, what I want you to understand with this. So I've discussed what cardiac sudden death is, what the steps are. I've given you a demonstration of what that is. And I want you to head and understand that you can make a difference in someone's life. But what I want to close with is what Dr. Avella said. He's an emergency room physician that helped develop the American Association's criteria for CPR in 2008. And he has the belief that doing something is better than doing nothing. You can make a difference.